part of its continuous efforts to save lives, alleviate sufferings, promote good health, and reduce the rate of infant mortality in the society in order to achieve sustainable development in Nigeria, the Marius Uchenna Shibogu Foundation, MUAF, conducted a 2-day free health care exercise to the benefit of the people of Igbooye Community, located at about 7 kilometers north of Egbe Township in the Egbe local government area of Lagos State. The exercise, which took place on the 19th and 20th of January 2014, took to the doorsteps of Igbooye Community qualified medical doctors, lab scientists, and other medical personnel to test and treat for free different diseases and sicknesses. As usual, they brought along with them many health supplies with the aim of carrying out tests for malaria, typhoid fever, hypertension, diabetes, eye diseases, and to give treatment to those infected with any of these. The day started with the old who as early as 7 a.m. came around in clusters, seated and waiting to be attended to as the doctors, nurses, and other specialists prepared themselves to hit the location where the exercise was holding. Aged mothers, fathers of Igbooye Community all sat and waited as the doctors prepared to attend to them. The executive director of Marius Uchenna Shibogu Foundation, Mrs. Marina Samuel, welcomed them and gave her opening speech to kickstart the exercise.
I want to start by thanking God Almighty for giving us the free gift of life, and without whom we're nothing. I also want to thank Him for making this day possible. I welcome you all to today's glorious occasion. I term it glorious because this is just one of many things that my late son, Dr. Marius, aspired to be in his lifetime. Dr. Marius Uchenna Shibogu was a beacon of light, a beautiful gift to his family, friends, and society. He was full of life, and he aspired to save the lives of others. But God called him to serve at higher realm. So he departed our world on 3rd September 2012.
The purpose of MUAF is to establish a platform to immortalize the person of Dr. Marius Uchenna Shibogu and to pursue his dreams of service to humanity and putting smiles on the faces of the less privileged in society.
The purpose of MUAF is to establish a platform to immortalize the person of Dr. Marius Uchenna Shibogu and to pursue his dream of service to humanity and putting smiles on the faces of the less privileged in the society. Just like we did in Igbooye Community last year in July 2013, we are adding more this time. Aside treating malaria, as you all know, is a life-threatening disease caused by the parasite called Plasmodium that is transmitted to people through the bite of infected mosquito. About 3.3 billion people, that is half of the world's population, are at the risk of malaria. People living in developing countries like Nigeria are the most vulnerable to this disease. The other one we're going to be treating is typhoid. Typhoid fever is contracted when people eat food or drink water that have been infected with Salmonella typhi. Next is hypertension. It's a condition in which the blood pressure in either arteries or veins is abnormally high. In addition, we have diabetes, and its complications are major causes of early death in Nigeria.
Dr. Marius wanted to be known for rendering selfless service to the less privileged, the rural dwellers, and the doubted in society.
Also, we're going to be treating eye diseases, and we're also introducing the cervical cancer screening for women and many more. So please, whatever ailment you have, feel free to see the doctors to complain.
The exercise began as the people were attended to at different sections. The doctors who are specialists in different areas of medical profession attended to various ailments. Ailments treated during the exercise are malaria, typhoid, hypertension, diabetes, eye treatment, and they also carried out cervical cancer screening for women of childbearing age.
The cancer screening section for women. Cervical cancer screening. Women between the ages of 30 to 49 are sent here for screening. And when they screen them, if they test positive, then they have to go for pap smear. And if the pap smear still shows positive, they are sent to an oncologist.
As the program progressed, the Oba of Igbooye Community, His Royal Majesty Oba Michael Gbadebo Onokoya, the Onijeru of Igbooye land, and his chiefs made their appearance at the location of the exercise as he expressed his heartfelt gratitude on behalf of his people to the Marius Uchenna Ashibogu Foundation for their laudable gesture. The Oba and his chiefs went ahead to be attended to by the doctors and specialists. The chiefs of the community gave their views on how helpful the exercise is to their community.
I'm Chief Oladele Adedepe, the Baale of Ipala village, Igbooye of Eredo, SCD, Epe Division, Lagos State. So the way I see this program is very nice. They gave us free treatment, free drugs, free everything. Nobody will say that he or she has spent a lot of money before he or she gets to the treatment here. So the treatment we are having here, the way I see it, it will help us, and it has been helping us now. I will know how much I will spend before I can buy all those things, but they gave us free treatments, free drugs, free everything here. So I have to thank them. I have to thank the organizers of this program, the Moa Foundation here. They have tried, and I pray that God will be with them.
My name is Chief Fatai Mustafa, and then the Olisa, second in command to Kabesi of Igbooye. According to what I see here, not only Igbooye people were benefited in this, both Ibon, Odonyogushi, Ilara, and Udoshuola, Mojoda are benefiting for this. I saw many people outside Igbooye here. When they hear that there is free health, so people rush to come.
The director of programs of the foundation, Mr. Ken T. Kendable, who also is the founder of the White Hope Foundation, also threw some light on his views on the exercise and on the progress of the foundation.
Yeah, my name is Kendrick Kendable. I'm a public health officer and also a clinical administrator. I am the director of programs for Moab Foundation. My role here as the director of programs is to make sure that we meet up to our motto by providing hope for better living. And providing hope for better living, we are trying to reach out to the less privileged, like places like this. Our last program we did was at Agelete Iba, where we went down to a particular rural area which they need such services. A lot of people were attended to for free, and a lot of cases were also attended to, like hepatitis, hypertension, blood pressure. So our main objective is to also reduce the level of maternal and infant mortality rates in Nigeria, and also to make sure that people have a better living in life through good health. After a public health research, we discovered that even a lot of people have been suffering from, though malaria is common, but we have high level of malaria parasite here. We also have high level of cervical cancer, which we have been discovering here, which a lot of campaign need to be made after this program, and a lot of awareness campaign need to be made on cervical cancer. And we also have cases of high diseases, a lot of aged people here, because the numbers of patients we attended to, they are almost all of them are aged, and many of them suffer from eye diseases. Likewise, we look at hypertension, also look at diabetes too. And so many of them like that.
Also, the Future Hope Foundation Orphanage Home, headed by Dr. Godwin Mbega Kudi, also contributed their support as they came with specialists from Germany to conduct tests and screening for malaria and other ailments among the people.
Hello, my name is Lea, and here is Lucas. We're coming from Germany just last week, so we have a few days here in Nigeria, and we come from Germany to learn the culture of Nigeria and also to support Dr. Godwin Kudi. He's the founder of an orphanage, and his organization is called Future Hope Orphanage Home, and we want to help orphanages here in Nigeria. We built a new orphanage home in Ogun State, and that's why we are here. But Dr. Godwin Kudi is also a man who helps when it's getting about malaria programs and healthcare, and so he asked us to join here, and we say, yeah, why not? We do a malaria test now. Here are these test things. We do blood on it, and then this liquid, and after 2 minutes we see if the person has malaria or not. If the person has malaria, the person can go to the pharmacy and get free drugs. Okay, it's huge. I think it's very important that comes free healthcare in the villages, of course. These people are far away from Lagos and from the big city, and they need to be educated about their health and how important it is to care about themselves.
As the exercise went on, Mrs. Marina Samuel went round to oversee and ensure that everyone was attended to.
We have here the pharmacy. You can see patients are waiting to collect their drugs. Once they leave the other end and they've been given prescription to collect drugs, they come here to collect their drugs. And it's being recorded, whatever they have been given. And you can see all the drugs on the table, the different types.
Later in the day, as doctors and other members of the team attended to people who complained about their health problems, the executive director of the foundation, Mrs. Marina Samuel, at the same time mobilized another set of doctors and members to visit the Oba, His Royal Highness, Bale of Igbooye Community, in his palace.
My name is His Royal Majesty Michael Gbadebo Onokwe, the origin of Igbooye land. Dr. Mara's Foundation is a good program. They have come to Igbooye to come and help my people. So, in giving them good health. So, they started today Sunday. And my people, the turnout is very large because of the good health. And we so appreciate it. We appreciate what they are doing for us. Because if they should go to the hospital, they are going to pay a lot of money. But Dr. Farah's Foundation, they gave us drugs freely, all tests freely. They did many tests, which I cannot continue to mention them. Many tests. They are all free for my people. So we so appreciate them, we love them. We thank them for caring for the poor people who cannot afford hospital bills. it's not the Igbooye community that benefited from it. All the towns and villages around us, Igbooye, Mojoda, Ilara, Odo, from here to Efe, a lot of people, a lot of towns and villages, they benefited from this free care treatment. So we appreciate it. This is not the first time some religious group that have came here and done it. This is not the first time. And then the state government they have done it. Not here at EG. Sometimes about 8 years ago. But this one is particularly for Igbooye, so we so appreciate it. Yes, I can. I feel some. Even though I just listen. Yes, it's I think the common illness there is high blood pressure, then a sugar problem, and malaria, and other diseases, and eyes problems. Because they give glass to people freely. Even myself, they change my glass on. So I see my people, they are rejoicing, they are happy about it. Instead of them to go and pay money, everything is free. In conclusion, I don't think I thank Marius Foundation. We thank them, we appreciate them, what they have done for us. So, and I wish they continue this program, not limited to our community alone. They should extend it to other places, especially rural places. And I use this opportunity to beg the Lagos State government and the local government to help Dr. Marius Foundation because they are doing good work. So they bought a lot of medicines to our people. They gave it to them freely, injection freely, everything free. So and this is a good foundation that cares for the lives of people. So it's good for the government to help them so that they may be able to continue this program, especially at the rural places.
This program is a very fantastic program. I so much like it because it doesn't waste much time, and people are attending the program, as it is expected, and they attend to people free of charge, and this makes people to be very, very happy with the organizers of the program. And in fact, this is one of the best attention given to people when we are talking about health care in this area. So I so much love it, and I pray that God will continue to assist the organizers and those that are attending also.
I like this project well. You understand, they give us full medicine. We see the doctors. All the doctors do fine for us. This project, I like it. Many of us, plenty, don't have 10 naira to go to doctor, say, doctor, I want medicine. Can't buy ordinary pencil, But as we reach here, God will appreciate them. All the uppers of this world, we will help them.
My name is Dr. Mrs. Julie Osemeka. I'm from 445 Nigerian Air Force Hospital in Ikeja, Lagos. I'm a medical doctor. Before Dr. Marius' death, Dr. Marius was one of our house officers at 445 NAF Hospital in Ikeja, and he was a very good friend of mine. And during his lifetime, he talked so much about his love and passion for the less privileged, especially in healthcare delivery. And so after his death, his mother feels that it would be a good thing to continue his mission. And I'm here as a support person to help bring his dream come true, even though he's gone. But we feel that he's still living. Our healthcare delivery is something that is very, very important, especially in rural communities where we do not have so much healthcare providers. And today, while we're here, we're able to see that the people of Ekpe really needed this healthcare because some of the investigations we've done and the patients we've seen, Many of them have diabetes mellitus. Many of them have malaria, hepatitis, especially in visual problem. We have tons and tons of people with visual problems, and our coming today has really helped to alleviate some of these problems to those people. And we're also doing cervical screening, and we've been able to find out that there are some of the women that are positive, which we will go further to test if there's cancer in those patients. Because of what we've seen so far from Agalete and Ekpe, we think it will be something very interesting to go to so many other rural communities that will benefit from this program. And we try as much as possible to go to as many rural communities as possible, because there are many places where they need health care.
My name is Dr. Godwin Kudi. I'm the president of Future Hope Orphanage Home. Future Hope Orphanage Home is an NGO that care and support children orphaned by HIV/AIDS in Africa. I'm glad to be here because this is a program that is worth doing. The community, they need our help, they need good health, they need love, they need care. And I think this is one of the ways we can help them. This is one of the ways we can care and support them.
I'm Dr. Campbell Elizabeth, working at General Hospital Ekpe here. Within Ekpe, we have a lot of hypertensive patients and diabetic patients in the Ekpe community as a whole. So if this could be done very regularly, it will create an awareness to people around the community, because most of them don't even know that there's a health facility that exists in
I'm Mrs. Marina Samuel. I'm the director of the foundation, Dr. Marius Uchenna Foundation. We are presently in Ekpe, carrying out a free health program for the foundation. Before now, we were in Agelete in 2013, where we had the first phase of the foundation. Today, actually, is the anniversary of the foundation, and we chose January 19 being his birthday. His death day is actually September 3rd, so it's actually 16 months. But I decided rather than have the foundation on his death day, I'd rather have it on his birthday, which happens to be a year for the anniversary today. So we're having the second phase of a 2-day program. We had a 1-day program in Agelete, which somehow we were able to touch over 1,000 people, and we couldn't really finish because it was a 1-day program. So this time around we decided to have a 2-day program. So today is day 1 of the program, and this time around we are emphasizing on other areas like the cervical cancer, which we did not touch last year. As we all know, a lot of people are dying of cancer, especially the women. Cervical cancer has been something ongoing now, and a lot of women are not knowledgeable on it. So if they are able to test for it early and it's detected early, they could get a solution, and that's why we decided also to go into that. So a test will be taken, and if diagnosed to be positive, they will carry out a smear test, and then from the smear test, they will see an oncologist. So that we are doing this time, and we're also emphasizing on the eye too. We didn't do eye last time, we're doing that, and we're also doing other things. Well, as you know, most people here are rural dwellers. Most of them cannot afford medical. So coming to Ekpe is also exposing them to having medical treatment and having the opportunity to see doctors, because sometimes they could go to a hospital but they are not there to. They could get there, they may not also be able to afford to pay. So here is an avenue for them to be able to see doctors and also be given free medication. I'm sincerely happy that I'm able to live my son's dream. Today is his birthday. I'm actually supposed to be seated with him and marking his birthday, but I give God the glory As I have been told by many people, I cannot question God. I thank God for his life. This was what he did while he was alive. He was able to touch a lot of lives. He was able to put smiles on people's faces. So doing this today on day one of this program, even on a Sunday, we are seeing so many people coming for treatment and they are happy getting this treatment. I wonder what tomorrow would look like. Tomorrow being Monday, a working day. So I really give God the glory, and I'm excited because if we had prepared this program for people to come and nobody turned out, our whole efforts would have been wasted. So I thank God that people turned out, and we are still expecting more people. And I'm really, really looking forward to tomorrow, because I know tomorrow will be, the turnout tomorrow will be more.
Day 2 of the exercise, which was billed to kick off by 10 a.m. as planned by the foundation, started earlier as a large turnout of people from different parts of the community who turned up as a result of the news of the success and impact of the previous day's exercise, which had spread around the community, and decided to avail themselves of this golden opportunity.
You know, the turnout is very, very large. People, the first day, the people turn out, but the second day is very, very large. It's very large. In fact, I know it's a big expenses, very big expenses. If some people can gather themselves and do this kind of health care for the people, for the poor people, yes, it's good the government help them. So I appeal to the federal government, the state government, even our wealthy people, Nigerians, to come out and help the poor people, as this Dr. Mara's Foundation has done. And I want them to help Dr. Mara's Foundation. I want them to have input so that they may be able to meet poor people. In fact, on behalf of my community, yes, I repeat it again. It's very, very, in fact, we don't have any, but to thank them very much. We thank them and we love them because they came to care for us. So we appreciate it. My people, they have benefited a lot. Even myself, I benefited from the free health care. So we thank them very much. My people, they are very happy. I ask God to continue to bless the foundation. And I ask God to continue to, they will continue to go from strength to strength and from power to power. And they will see mercy from the people and from the government too. So I thank them very much. And I pray that when you people will be going back, the Lord will lead you. You will reach home safely. God will give you journey mercies. And I promise you that a little that I can help, by the grace of God, I will do it. I don't have much, but by the grace of God, the little that can help, I will do it. Thank you very much.
I hear about this program yesterday that they are friends to them. That's how that everybody came here. They answered them, doing everything, and they're giving them drugs. We thank God for.
People are benefiting because these villagers people, you know, some people have got many diseases that they don't know. When they reach there, they detect many things that is in the body of some people. Like me now, I didn't know that my BP is up before. When I got there, they detected that my BP is rise. So they treat me well. Even about my sugar, I got small of the sugar. They treat me about the sugar and the level of hypertension. They tell me that I got small of hypertension. So they treat me. The benefit for the villagers is that all the medicine they give them free. They give them free. They didn't sell anything. Even those people with eyes problem, they give them eye glasses, treat them. I even like the program because they help everybody.
I complained about my eye problem. It has been solved. This an eye glass given to me. Malaria drugs given to me again. So I think I have to thank them very much. Yes, God is in them. I mean the MUA Foundation. Yes, God is with them. My general conclusion is that I thank the MUA Foundation very well, and I want the other NGOs to emulate them so that people will be free from ailments, they will be medically fit around. So the government should encourage them.
The king stated that the community finds it difficult to get drugs when one finds out he or she has a health issue. But it is a very good thing that the Marius Uchenna Ashibogu Foundation made it so easy for his people to access medication free of charge.
Not everybody can afford going to the hospital. If you're ordinary adult, some people cannot afford it. But this foundation, they gave free medical care to my people. So, in fact, we are very, very happy. This program is not the first that is coming to my community. So I can say this is the third one. But some missions, they have even came with this kind of program. So, but this one is very, very superb, more than all the ones we have been having.
I'm Honorable Olukoya Adeniyi, the Supervisor for Health, Eredo LCDA. Once again, I want to appreciate the organizer of the program. On behalf of the council, on behalf of the Eredo Local Council Development Area, I want to appreciate them. I want to thank them on behalf of our people. And I want to also, as Oliver's twist, I want to say we are looking forward to seeing more of this program in the nearest future.
The foundation made progress as they found out and diagnosed different people with health conditions in the community. This is not the first time the foundation is embarking on an exercise of this sort, but the second time in a community to give out free medical attention. But it is the first time for the Igbooye community to experience such an exercise of great impact in their community. The vision and mission of MUAF is to save lives, alleviate sufferings, promote good health, and reduce the impact of infant mortality in the society in order to achieve sustainable, healthy lifestyle in Nigeria.
Our aim and our objective is that we reach out to people that we know that need such services. This community is lacking health care facilities. As you can see, if you look around, there is no clinic around here. There is no maternity home. The general hospital is very far from them. So that is why we came here and we discovered that we now conclude that Igbooye is a community that needs such exercise, and that's why we are here. So as you can see, we are the exercise is still progressing, and we are getting high number as we progress, especially the aged here. And also we later discovered that there is no even hospitals around here, there is no health facilities around here, and that is exactly our motto. We go out and source for a particular communities that really need such services, which Igbooye is part of it. And we hope for more, according to our motto, providing hope for better living for humanity.
It's a laudable project. At least anything you have to do for the betterment of humanity, it's an encouraging project. So far we've been here since yesterday, and the program is really, really successful. The turnout is much. You can see up till, as at yesterday, the crowd was much, and today is even more than what we had yesterday. I think the program is very successful.
The common ailments that we discover are basically the high amounts we discover are diabetic patients, likewise hypertensive patients, and we also discover those ones still from the aged. And strongly we also discovered, based on the screening we did on cervical cancer, we discovered enough cervical cancer positive patients, and we are also referring them to the Eredo General Hospitals, and likewise to a lot of specialist centers also. And we also orientate them about the cervical cancer of a teen, and which a lot of them, we are really glad about it.
Interestingly, as of yesterday, we had about 4 positive cases. Positive to breast lump and positive to cervical cancer. This morning, so far, I've had 2 positive cases. So it's better we came, and at least these cases, we've been able to refer them for further treatments. Refer them to the general hospital that is nearby here.
Yesterday was day 1 of the program. We did have a huge turnout, but today, as you can see, we had more people. I believe the people who attended yesterday must have gone back to talk to their people, the other community members, letting them know that there's a big thing happening out here in Igbooye, in Eredo. We've had the aged, we had the children, we've had women between the ages of 30 and 49 who have been screened. We planned starting by 9, which was supposed to be our takeoff time, but by 6:30 we had a large turnout of people here sitting, waiting already to be attended. So that goes to show that they appreciated what we did yesterday and really would want to be part of what we're going to do today. So far so good. We thank God. We're treating a lot of people, and we still have time, and we're still going to treat more people. And by God's special grace, by the time we leave here, there'll be more people smiling. We already have people smiling as they're going. They are taking, looking at their drugs, smiling, like the woman going over there. She's smiling, and I believe we have more women and children like that too, smiling.
I will love to thank everyone, at least for their response, of at least coming to this exercise, and also thanking the MOH, thanking the local government chairman, thanking the Oba of Igbooye, and so many of them like that, supervisor for health, because they gave a great support for this program, and a lot of people have benefited from it. And also, we also need to thank the founder of this foundation, Dr. Marius Ashibogu, which is the founder of this foundation, though he's no more with us, but his legacy is still growing, and it's because of what he left behind. A lot of people are benefiting from him. Dr. Marius only lived for 28 years, but he left a legacy that thousands of people are benefiting from now.
The Marius Ashibogu Foundation platform is set to reach out to rural areas where good and quality health care may be lacking. Hence, the exercise was tagged "A Healthy Nation, a Wealthy Nation."